to another episode of Two Sisters of a Certain Age, Conversations with a Therapist
and a Doctor.
I'm your co-host, Judy Grant, licensed marriage and family therapist.
And I'm your co-host, Dr. Sophia Grant, board-certified pediatrician and board-certified child abuse pediatrician.
Hey, Candy, before we get to our fabulous guest, Monica, I just have to bring up the fact that ISPCAN is coming up again. And for our audience, Candy and I have presented now 2 years in a row at ISPCAN. And of course, we submitted yet another abstract for this year. Didn't pan out the way we thought.
Yeah, we were waitlisted. And
what is that about?
I'm not used to that position, but I respect them, and I think we decided that even if we don't go, we'll find out like sometime in the next month if we were taken off the list. But even if we don't go, we are still going to have a fabulous sister trip. So we're pivoting. We're just like, I'm not going to let the disappointment soak in. Just shake it off, move on.
Yep, and do something else that's great and fun.
Yes.
So we'll see, folks. We'll see if we will be presenting yet again at ISPCAN, or if we're going to be off doing something else pretty extraordinary.
Yes.
So, Candy, let's go ahead and bring in our guest today. Would you like to introduce?
Yes. This is Dr. Monica Bruce, otherwise known as the Smiling Dentist. Dr. Bruce has her practice in the Los Angeles area, and the connection we have with her is that she is a college friend of a former guest of mine, ours, Dr. Daphne Brazil. So Daphne and Monica went to college together at UCLA, and then I was chatting with Daphne, and she brought up her dentist friend. I said, dentist? We've been wanting to have a dentist on the show. So I reached out to Monica, and she kindly said yes. And I think it's very important because, teeth change as you age. And I feel like my teeth have been disappointing me lately. And I wanted to talk about oral health and welcome Monica onto the show. Welcome. Thank you for being here.
Thank you for having me. This is very exciting being a part of your podcast.
Thank you. So, Monica, what do you notice about older people in midlife, people of a certain age? What do you notice about the dental needs that they have?
Mostly their dental needs are more, not as many cavities per se, like we have when we're younger or in teenage years and things like that, but it's more what we call periodontal disease, gum disease, where patients are starting to lose the bone structure around their teeth, so therefore you're losing teeth, and that's an issue. And so it's a lot of times it's replacing missing teeth, and and patients just, I'm starting to find more patients are just needing more just general oral health care. Just, you need to come in and see the dentist. You can't do 2 times a year anymore. You need to come and see the dentist 3, maybe 4 times a year, just to stay on top of things, because it goes out of whack. I mean, with medications that you're taking,
right,
with just changes in your body as women, the menopause,
right,
all of that plays into your oral health. It's all interconnected, and that's some of the things that I have to reinforce with my patients, that all of this, especially periodontal health, connects with the rest of your body, and so it's important to maintain that.
Now, what do you think is good oral health? Like your ideal patient, what do they do?
Most, for me, I try to encourage patients to brush and floss twice a day, every day. That's pretty much the standard. I know that, will you do twice a day? Maybe you'll brush. Most people are like, oh yeah, I brush. But to me, flossing is the key. And I know, and not everyone can maneuver and manipulate floss. That can be different. So my hygienist and I, we together try to create a treatment plan a regime that works for
Uh-huh.
you, that is specific to the patient. That's what's important. So brushing and
Well,
flossing is what I preach. But if you're not going
uh-huh.
to
Right.
floss, then I'm going to say get oh my goodness, and I'm blanking, like a water flosser or a
Right.
Uh-huh.
or a
Water
water
pick.
Mm-hmm.
Uh-huh.
pick, or
Mm-hmm.
get a
Uh-huh.
power brush versus, because if you can't hold a regular toothbrush, which is really narrow, get a power brush. Get something that you can grip and hold to brush your teeth. So those
Like
kind of things.
when you say power brush, do you need like a sonic hair, an electric toothbrush?
Yes, yes.
Okay.
Sonicare,
Okay.
Mm-hmm.
Oral
Mm-hmm.
B, any
Uh-huh.
of those, as long as they have soft bristles. And I am
Right.
so. It's like, please, soft bristles. Anything harder than soft, use on the grout in your bathroom. That's it. So,
Uh-huh. Okay.
Okay.
I mean that's good to know because,
Right. Right.
back
Mm-hmm.
in the day, I'm like, I want to make sure my teeth are clean. I'm using a hard bristle so
right.
I can but then I
Yeah.
was told, and what's the importance of a soft brush?
A soft
What
brush.
does it destroy your teeth? I
Well,
mean, the hard brush.
well, the heart brush can. It's a little more, but it's more about when we're brushing our teeth, we are more focusing on that place between where your gums meet your teeth. That's where
Uh-huh.
plaque builds up, where the bacteria builds up. So you
Uh-huh.
need something soft. Plaque initially is very, very, very soft. You don't need to
Mhm.
scrub to remove
Right.
soft
Mm-hmm. Mm-hmm.
particles and things on your teeth. So that's destroying gum tissue if you go harder than a soft. So that's what.
Monica, a question for you.
Hmm.
So when we are, we're brushing, we're trying to keep our oral health, up to date, up to speed, what have you. There are inevitably places that I miss in my mouth.
Right.
I just cannot get there.
Mm-hmm.
It's with the toothbrush, it's with the floss, and there's still these places I can feel with my tongue,
Mm-hmm.
and
Which I'm
it's
doing right now.
right as I'm
Yeah.
thinking about it.
Uh-huh.
And listen, and sometimes it's like it's so annoying because I know I just brushed my teeth,
Mm-hmm.
I know I just rinsed, I know I just flossed, but I still can't get to that spot back there.
Mm-hmm.
So what do you suggest for those hard to reach places?
There are different brushes that might help. Some of what we call interproximal brushes. They're very teeny little brushes that are like
I've
Christmas
seen those.
trees, and they can kind of
Mhm.
get in between.
Oh,
There are brushes
Mhm.
right.
called in-tuft brushes, which are just bristles that a little more stiff, but they can go way back behind your teeth because there's it's long-handled brush and it goes
Uh-huh,
back
uh-huh.
behind your teeth.
Or
So
back here.
yeah, or
Okay.
back there, or back
Okay.
back in some of those spots. There, talk with your hygienist or something. They
Right.
have a wealth of oral health things that will help you specifically tailor your oral health to for you. So that's what's really important.
Okay.
So ask them.
Okay.
There's so many other tools out there that you can use to in those little hard to reach places that work.
Right. Okay, so I gotta ask about a little idiosyncrasy of mine. And Candy, you might remember this. Um, our father, when he used to brush his teeth, it was a whole production, right? The toothpaste was everywhere. It was dripping down his arm. The toothbrush itself was splayed.
Splayed.
Just, and I remember watching him as a little girl, like, I want to be like daddy. So I took on these habits. Well, it's no longer dripping down my elbow, but my toothbrush, it splays out like within 2 weeks of using it. And people are like, you're brushing too hard. I'm like, but to brush softer like wouldn't be doing anything, and I just don't understand, like, I don't understand what I'm doing because I go through toothbrushes so much faster, I think, than the average.
Well, yes, you probably are brushing a little too hard. And just understand your teeth, it's really not your teeth. I mean, yes, you are cleaning your teeth. I get that. But
Mhm.
it doesn't take a lot to clean your teeth. And your tongue is a toothbrush, kind of. It brushes as you
Mhm.
talk, your tongue rubs up on the insides of your teeth. So it's all a part of brushing. So a lot of the newer electric brushes actually have sensors on there when you are brushing too hard. When you press too hard
Mm.
with your toothbrush, then it gives you
Mm-hmm.
a sign or it stops. It says, okay, look, you're doing too
Wow.
much. So,
Hmm.
so a lot of the new toothbrushes too, it's just small, gentle circles at the gum line, and then go back and just gently brush your teeth. That's it. It's not it's not like you're scrubbing in your bathroom,
Right.
it's
Yeah.
not,
Hmm.
you're not
I,
going
I mean, you would
that.
laugh if I grabbed my toothbrush right now. You would laugh.
So, and if you have to, and when it's splayed out, it's being inefficient. So you should change out your
Mm.
brush. When you start
Hmm.
seeing it splay, one, you're brushing too hard, but two, it's time to get rid of the toothbrush. It just is.
Okay.
It's not helping
All
you at
right.
all. So,
All right. I'll swap it out today. Thank you.
Um, I got one of those Oral-B electric toothbrushes, and I just feel like my teeth feel cleaner when I'm done rather than when I use kind of a manual toothbrush. And Judy, you might want to try it. I got it like at Costco,
hmm
but
All
I just
right.
feel like my teeth are cleaner.
Okay.
Um, Now, Monica, what are your thoughts on mouthwash?
um, I'm mixed. If you
Mm-hmm.
like them, use them. They're not.
Uh-huh.
Some of the older traditional stuff like the Listerine and stuff that has a little more efficacy and breaking
Mm-hmm.
down plaque and stuff. But anything
Mm-hmm.
will break down plaque. Just
Mm-hmm.
water will break down plaque for you. So it's if you like it, use it.
Uh-huh.
I would probably try to steer clear. Yes, Listerine has a very high alcohol content,
Oh my
so
gosh.
well, it does, but and
Yeah, no,
Mm-hmm.
I know.
it
And it's so harsh. It's like,
yes,
you know,
yeah, it
I remember
burns.
as a
It
little
it
kid,
does
because
burn.
our parents
Right.
used the old-fashioned
Oh,
kind of amber-colored
yes.
Listerine. It was
Yes.
like gasoline in my
Yeah.
mouth.
Mm-mm.
It is
Mm-mm.
I mean, I think there's a Listerine commercial that I saw that's like, feel the burn. Like, that's supposed to work.
Uh-huh.
And it probably does, but it doesn't have to be. You can use the non-alcohol version of Listerine.
Uh-huh.
You can use
Right.
Scope. Some of them have fluoride, and that's a wonderful thing, a wonderful
Mm-hmm.
addition to
Mm.
your mouth rinse. But overall, I feel neither one way or the other
Okay.
about those.
So, Monica, I want to get back to something you said. As women of a certain age, you said that menopause can impact our oral health. Can you talk a little bit more about that so we can be more mindful of those physical changes and how that can impact?
Well, just as when women are pregnant and you have more hormones rolling through your body and things like that,
Mm-hmm.
and there are conditions when you are pregnant that people get from their gums just because your body is just doing a whole bunch. We're,
Mm-hmm.
we're doing a whole bunch.
Mm-hmm.
Mm-hmm.
And the same thing as we lose some of our hormones and things like that, you may find your mouth gets a lot drier. So it's really important
Mm-hmm.
to brush, to make sure that, use a toothpaste with fluoride. I know there's so much controversy about fluoride and using fluoride and not using fluoride. Bottom line is, I recommend fluoride for everyone, even my adults. My adults get fluoride treatments, my kids get fluoride treatments. Everybody gets a fluoride treatment if you're comfortable with fluoride. The ADA says it's safe, and I firmly believe in what fluoride can do for your teeth. So
Mm-hmm.
Mm-hmm.
it's more just being generally, we're probably more, like I said, dry mouth. We're probably susceptible. We are susceptible. Gums can be a little more irritated. So that's why it's just really important to brush, to see your dentist regularly in regards to those things.
Mm-hmm.
Did I
Mm-hmm.
answer the question well?
Mm-hmm.
Yeah, no,
Sure.
no, no, absolutely. Yeah, thank you, thank you. Okay, so gum disease.
hmm
Um, Let me ask you, when I go to the dentist for a checkup, they do the little pokey thing,
Yes.
one, two, three, four, all the way
The
around
pockets,
the
yeah.
pockets.
Yes.
Is that a gum disease sort of detector? Because I know you don't want deep pockets,
Right.
but what does that even mean?
So what that means is what I'm doing, or what the hygienist or whomever seeing you, what we're doing is measuring the the height of the bone around your tooth. So in that pocket, between your tooth and your gum, at some
Mm-hmm.
level, there's bone underneath there. And so
Right.
what I'm doing is measuring where, or getting a close estimate as to where the actual bone is. Am I probing all the way down to your bone? It may feel like that, but no, I'm not. I'm just measuring that, what we call the pocket. The numbers I tell my patients, ones, twos, threes, those are good. Start getting into fours and fives, then I'm starting to get a little more concerned, because that means you're starting to lose bone structure around your teeth. You're at the very, very beginning stages. So as you lose more bone, your teeth get more mobile, and then you're likely to lose your tooth. So that is what periodontal disease is. It's the loss of
Okay.
the supporting structures, the bone and the gum tissue around your tooth. And then, therefore, you start seeing people's teeth start looking more spread out. Oh, I have more spaces between my teeth. And that's why they're losing that bone structure, which is keeping your teeth in their place. They're starting to lose that bone. Your teeth are going to start spreading out. And that's what you're starting to see.
Okay, and is that just a natural part of aging, or is there something that we're supposed to be doing to prevent that loss of bone structure?
Some of it is preventable. I mean, if you're brushing and flossing, that bacteria that I'm recommending you brush and floss twice a day, that contributes to bone loss. So
Okay.
therefore, if
Hmm.
you're removing it regularly and keeping your teeth clean and going to see your dentist, then you won't lose that bone structure. Some of it,
Okay.
in some cases, yes, it may be contribute, some systemic health things like that can sometimes contribute to it. But the bottom line is, if you brush and floss, if you maintain good oral hygiene, bone loss is can be minimal. I mean, I have some of my patients, my 90-year-old patients, who have all of their teeth. So,
Hmm.
it can be prevented, or you can slow the process down. But for the most part, just good oral hygiene, and yeah, that's it.
Okay. Okay. All right. Thank you. That's helpful.
I have a follow-up question. Does taking vitamin D and calcium help with the bone loss in your mouth?
To some degree, it can.
Mm-hmm.
It can. It can.
Okay. All right.
It's not going to harm it in any way,
Mm-hmm.
because I know we as women tend to be, well, I know
Right.
vitamin D deficient as I am,
Mm-hmm.
and so it's
Right.
just it's very small, but it
Mm-hmm.
can have some effect.
Right. Right. And that's something that's recommended for a lot of women our age, just because of the risk of osteoporosis. So,
Hmm.
we kind of all need to be taking it depending on your risk factors.
Right. Hmm.
Okay. All right. I'm thinking, you know, Candy, you're currently in the process of some dental work.
God, this is
At,
so embarrassing. Yeah. Now you had to air my dirty laundry.
yes, yes. But no, I'm asking, and you can share more about that specifically, Candy, but like, do we tend to have more dental problems as we age? Because Candy, I don't think, like, you're doing a crown, right?
No, I'm doing an implant.
Okay,
I
so
Yeah,
what's
so
going on with your mouth?
I had a crown, which is kind of like, I had a cavity and it got big, so they made something to kind of sit on top of it, right? That's a
Right?
layman's term.
Right.
So I had a crown for years and years. And then I bit on something and it came off, right? So I was like, okay, we will just put this crown back on. But it was too low. Like there was nothing to attach. Like my remaining tooth and the crown broke off. So then I had to have an extraction, and
Okay.
then they put a metal thing. Okay, I'm gonna be very transparent. Right now I'm wearing a retainer. See, this is the
Right?
beauty of YouTube. They
Right?
call it a stay plate.
Yeah.
So like you see, it looks like I have all my teeth, but
Oh my
No, she
gosh.
did.
Ah!
you see, I have a hole right here.
Oh, okay,
And
okay, that's real. That's
yeah,
transparent.
yeah. And I can't. I just like when I smile, I have a big smile, and then you see the hole. I can't walk around like this. So I had the extraction, and then I went back for them to screw the thing into my bone, and then I have to go in to get another thing. So, I mean, it's first of all, it's extremely expensive,
Right.
extremely expensive, and it's not overnight. I was like, I can't be walking around like this. I want to get this taken care of. So like June, October. I mean, it's just now. How long does it typically take, Monica?
Well, it can take, depending, it can
Mm-hmm.
take 6 months, 7 months
Yeah.
to go from extraction to final restoration. So
Right.
I mean
Right.
I tell my patients it's like it's not a simple like pop pop pop, yes yes I've got my
Right.
tooth.
Right.
No,
Right.
it's
Right.
we
Right.
have to wait for healing. We have to wait for
Exactly.
Yeah.
there's it's a process. So yeah,
Right.
Sure.
And so I my oral surgeon, or what is it, a periodontist?
either one.
Mm-hmm.
She's Yeah, she did the procedure, and she has this teeny tiny meek voice like, hi. I'm like, this woman's gonna be does she have enough chutzpah to get in there? And she was great. And when I had the procedure done, all I had was like my first time they gave me like a benzo to kind of calm me down, but I was so sleepy afterwards. I slept for like 12 hours. I didn't like it. I have a decent tolerance for pain, so that when I went in for the follow up, they just gave me local,
Mhm.
and I
Mm-hmm.
was fine. I didn't need though, but a lot of people are very anxious when they go to the dentist, and the
Yeah.
benzo will take care of the anxiety. So it's a multi-step process, and I feel blessed that I can pay for it. A lot of people can't pay for this, and then the alternative would be a bridge, right?
Correct. That is correct.
Now, can you describe what a bridge is?
Well, bridge is basically a like it's crowning, putting crowns, or like you had mentioned,
Mm-hmm.
Mm-hmm.
fully covering the two teeth outside of the space, and then
I
attached
see.
to that is the missing tooth. So the one good thing about a bridge is it is not removable. So once you remove the tooth structure around the teeth on the outside of the space, you cement crowns and the bridge all together, one unit, three
Right.
pieces, all down into your mouth, and you don't have to worry about it coming. Well, it can come in and out, just not
Uh-huh.
in and out in that regard. Like just like your
Right.
crown came off, sometimes your bridge
Mm-hmm.
might come off. The cement will
Right.
wash away, or it'll go away, and so you may lose that. That is probably. But I always try. My thought is, if you can, put an implant there, because sometimes it's not worth removing good tooth structure around
Right.
two
On
perfectly
the
good teeth. Like
Yeah.
if you don't have any fillings in
Mm-hmm.
it, you don't have anything going on with those teeth, why would you destroy some God-given enamel, which is the
Right.
strongest substance
Right.
in the human body, to put
Right.
some some artificial stuff on? So I
Uh-huh.
if it's within your budget, you can do it. And honestly, more and more dental insurance companies are starting to pay for implants because they're finding it's what the patients need. I mean, it's more responsible way of
Mm-hmm.
replacing a missing tooth than it is to put bridges up there. That's just my thought. Or you wear, like you're wearing right now, Dr. Sophia, you're wearing something that's removable. That's
Right.
your only other option. It's either removable, it's a bridge, or it's an implant. That's it.
Right.
Right.
Those are my own. Those
Now
are
the thing about this appliance is you can't eat in it. So
mm.
like if you're out to lunch and you get your food, you kind of need to tuck it in your bra and then eat. And it's just awkward.
It is. It
Um
can be.
and Now, back in the day, we had a lot of relatives who had dentures,
Yes.
and there's some
Mm-hmm.
people who still have dentures. With our relatives being Jamaican and not having access, and not
Hmm.
having a ton of money. Now, what's the difference? What's a partial denture? Can you eat in a partial denture?
Yes, you should be able to eat in a
Uh-huh.
partial denture. What you have in your mouth technically
Mm-hmm.
is a partial denture. You're replacing missing teeth. It's a partial. A
Uh-huh.
full denture is a full
Mm-hmm.
denture. You're replacing all your teeth. Partial dentures are
Uh-huh.
just for missing 5 or 6 teeth or whatever it is. And
Uh-huh.
yours is a form of partial because it's removable. So it comes
Mm-hmm.
in
Okay.
and it comes out of your mouth. You should be able to chew with that. I don't kind of not sure why you
Uh-huh.
can't chew with it, but you
Well,
should be.
I
And maybe you're
I
not
tried to
comfortable.
chew. I tried to chew, but like food gets up in the top part of
Yeah.
it,
And
So that, yeah, I can chew, but it's
okay.
just,
It's
yeah.
more uncomfortable and annoying. Yes, that and that's
Exactly.
and that's the one thing about a partial is food eventually, because of you're wearing that thing constantly and it's pressing on your tissue, you start having spaces underneath there, and then
Mm-hmm.
food gets caught underneath it, and that's one disadvantage of having remove a
Right.
partial
Mm-hmm.
denture. One good thing is, yes, you can take it out, you can rinse your mouth out, you can put it back in, keep
Right.
on going.
Uh-huh.
So.
Now, I feel like my teeth are shorter than they
Mhm.
used to be.
There you go.
Judy, have you noticed that?
Well, okay, so I have a long history of grinding my teeth. Long, long history. And I used to wear night guards, and then they'd give me headaches, and I'd go and get them refitted. And at some point, I'm like, I can't even be bothered. But my dentist has discussed with me the fact that my teeth are wearing down.
Mhm.
And I don't know if it's because of the continuous grinding, but they're not, I mean, they still look pretty good,
Yeah, but they're
but
not
they're
as
not
tall.
as tall as they once were. But Candy, you don't really have that grinding issue the way I do.
No, I don't grind, but I still feel like my teeth are getting skinnier and I'm getting bigger. They're getting. I don't know because I have small teeth to begin with, but they
Mhm.
just seem a little bit shorter.
I-
What's up with that?
It's just, it's now that is
Aging?
somewhat of the aging thing. Think about it.
Uh,
These teeth have been in our mouths, some of them, since
yeah,
we were six
Right,
years old.
yeah,
Constant
right.
chewing, they're going to wear down at
yeah.
some point. That's why, we all go, people are, some of my patients come in, they're like, man, these fillings, they've been there since I was something. I go, they're going to have to be replaced at some point. I mean,
Mm-hmm.
nothing, and unfortunately, lasts forever. So just like our houses go through cycles, you
Right.
fix, and then eventually you got to go back and fix that other thing that you fixed
Right,
Uh-huh.
10,
right.
15 years
Uh-huh.
ago. An evolving process, and and in no way do I tell people to change your diet. Don't do it.
Mm-hmm.
Enjoy life, and
Mm-hmm.
if you
Right.
can, get your teeth fixed. I mean, if you can't, it's like I'm sorry to hear that you're not able to tolerate the mouth guard, but at the
Mm-hmm.
same time, you have to do what's comfortable for you, and your dentist will figure
Right.
out what's going to be best for you. So.
Yeah, yeah, it would just, after wearing out the headaches and the pain in the jaw,
Wow, you
I'm
really
like,
grind. Uh-huh.
oh
I
yeah,
didn't
I've
realize.
been. I remember Mummy telling me that she would hear me grinding in my sleep.
Oh
Like
yeah,
she'd come in and
I
hear
have a
me.
vague recollection, but like since we've been traveling together, I haven't heard you grind.
I don't think I do it as much
Probably
or to that extent, but
Mm-hmm.
yeah, it's just
she's
just
on
part of.
vacation. She's more
Uh-huh. So
Right,
she
she's
relaxed,
doesn't
so
have
she doesn't
relaxed.
have
stress.
to grind.
But you want to hear something funny? It was when Judy and I we were in, was it Sweden or
Mm-hmm.
Scotland? It was Scotland. She said, "Candy, you snore a lot." And since I'm single, the kids aren't home. And Judy made me get, because of her observation, I was tested for sleep apnea.
Right.
And I have bad sleep apnea. And now I sleep with a sleep apnea machine. So I guess this is me telling people to sleep with somebody every now and again.
That's a good way to put
So, so that they can observe your sleep because you don't know what you're
Right,
doing.
that's true.
Right,
But I
right,
mean, based on that observation, I wear my apnea machine and
right,
I feel like I get better sleep. And
right.
this is kind of left turn into the conversation, but before I had the sleep apnea machine, I would wake up multiple times to go to the bathroom Turns out I just wasn't sleeping deeply. And I would say, oh, I'm waking up because I have to go to the bathroom. Now I sleep through the night like almost every night. So,
Right.
yeah,
Right.
That's a good
yeah,
thing.
different conversation, but we went there because it's important because sleep apnea is a horrific thing
Right.
to have in terms of
Right.
long-term problems. Now, Monica, I have been to a dentist and they say they have devices for sleep apnea.
hmm
What are your thoughts on that?
For someone also who suffers from sleep apnea and has a sleep, I tried multiple mouth appliances. To
Mm-hmm.
me, none of them work, but that could have been
Yeah.
just me. I
Mm-hmm.
other people swear they work. So,
Mm-hmm.
I don't have a lot of, experience in the sense of knowing what works for other
Mm-hmm.
people, but some people say those mouth appliances work. All I know is when I did one of them, I was just like, oh my God, my jaw is killing me. Because
Mm-hmm.
Right.
they put your jaw in a very different, more uncomfortable. Your lower
Mm-hmm.
jaw is more moved forward, and so when
Forward.
you wake up
Mm-hmm.
in the morning, I was just like, oh no, this isn't gonna work
Right.
Mm-hmm.
for
Right.
me. So the sleep apnea machine, CPAP works fine for me. So I do
Uh-huh.
that one. So.
Yeah, that's what I have. I had some friends visiting a couple a couple weeks ago, and they stayed in the spare bedroom. And in the morning, I went in to check on them, and there were two CPAP machines on the nightstands, husband and wife with a CPAP machine. Yeah,
Right.
Yeah, yeah.
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 So, Monica, let me ask you about, and I don't know how much your practice works or do with like more cosmetic
hmm
dentistry,
hmm
from the whitening um, to caps. I didn't even know if
The
those things still
veneers.
exist. The
Yeah. Uh-huh.
veneers.
hmm
What are, because sometimes I think like I could do a little bit of whitening,
hmm
right?
hmm
Um, but there's so many products out there, you don't know what is legitimate, what's going to work, what's not going to work. Do you have any thoughts on that for us?
Um, I I use a product in my office that I like that works. I do recommend some over the counters. Everybody. Once again, it's kind of individual. Some products
Mm-hmm.
will work excellently. Some people would say, "Oh yeah, I use Crest White Strips. They work perfectly for me. They work.
Mm-hmm.
I got what I wanted." Some people need a little bit more, so I have some product in my office that does whitening. I do different types of whitening. There are kinds that you know, don't custom fit your teeth so much, kind of more like a Quest White Strip, a little
Mm-hmm.
stronger, and those work fine for some people. Some people want the clear trays where you load the gel into the trays and you
Right.
wear those at
Right.
night. Some people like
Uh-huh.
those, and then I do also in-office whitening. So there's a multiple ways to do it, and
Okay.
sometimes it doesn't even work. Some people's teeth just don't get whiter for maybe
Mm-hmm.
they don't have enough enamel on their teeth. It just
Okay.
varies, and so it's hard to sometimes manage people's expectations. Some people have whitened
Sure.
before, and it's hard to get it back to that original whiteness,
Yeah.
but you can get it reasonably close. So
Mm-hmm.
it's a very varied box. It works, and it does work, but
Mm-hmm.
it's just
Mm-hmm.
varied in depending on the patient. And then yes, I do cosmetic dentistry. I do veneers, which are just almost like the best way to describe it is you're looking at your kitchen cabinets and you're like, I want to change the color of them. So you put a facing on the front of your tooth, and that's pretty much
Mm-hmm.
what
Oh.
a veneer is. It's just a facing that goes over the front of your teeth. You can control shade with that. So once
Mm-hmm.
you put them on your teeth, that's the color your teeth will be. And, you know,
And that the veneer is on permanently?
yes, it is bonded to your teeth. Sometimes and
Okay.
depending, there are some people who do what we call veneers where you don't even have to remove any tooth structure from the front of your teeth. They just, roughen up the surface and bond that veneer on there. I usually like to take a little bit of tooth structure, just a little bit, not a lot, and to put a very thin, thin, thin facing on the front of your tooth. So it doesn't You don't want the veneer to make your lips stick out too far because you didn't remove enough
Right.
tooth structure. You know what I'm saying? And sometimes just subtle things like that are enough to be uncomfortable to patients. So,
Mm-hmm.
Right, right. And you don't want those like big chiclet teeth
right,
in your
exactly.
mouth.
I mean, I try to steer people away from that bleachy, bright white because that's not
Yeah.
natural. But,
Mm-hmm, mm-hmm.
people want what they want. So, I like nice white teeth, but they don't have to be like the blinding where I got to put on my sunglasses to look at your teeth
Right.
Right.
kind of thing.
So, just as a reminder for our audience, what are those foods or drinks that can contribute to dulling,
Staining. Uh-huh.
staining your
You'll
teeth?
be kind of sad. Sometimes red wine, anything. I tell people when people are bleaching, anything that will stain a white T-shirt, you kind of need to avoid. Initially, when you're whitening your teeth, because when you're
Right.
whitening your teeth, you're kind of opening up the pores of your teeth, the
Sure,
enamel
sure.
of your
Mm-hmm,
teeth.
mm-hmm.
So you don't want to start putting intrinsic more stain into your teeth. So I mean, things like red wine, grape juice, mustards can stain. There are a lot of foods
Tea.
out there.
Tea and coffee.
Tea and coffee. Some people drink. I have one of my staff people who drink coffee through a straw because she doesn't want those. She doesn't want it messing up her front teeth.
Oh,
But
wow. Oh, so
Mm-hmm.
so is that effective?
it works for her. Yeah, yeah, it can
Uh-huh.
work. It can work because if you think about
Mm-hmm.
it, the coffee isn't bathing the front of your teeth when you drink.
Right.
It's going back towards your throat, so it's
Uh-huh.
not staining
Right.
at least your front teeth. So things like that. Just really anything with deep, deep, deep stain, grape juice.
Okay.
Yeah,
Mm-hmm.
those kind of
I
things.
mean, it's what you said about if it's going to stain a white T-shirt. I think we can all envision like what would stain a white T-shirt,
Everything,
and
practically.
Mm-hmm.
Everything. It's like, but
Uh-huh.
like I tell patients, it's like, don't change your lifestyle because now all of a
sure.
Mm-hmm.
sudden you're doing just enjoy life. And with a lot of the bleaching gels, like depending on the product that you have, you can always come back and get more gel for me if that's what if that's what you need to boost up
Mm-hmm.
your smile back to where it close to where it was when you first did your bleaching, your whitening. I like to call it whitening rather
Right.
than bleaching because it's just
Yeah.
Okay.
bleaching sounds
And
horrible.
when you talk about whitening now, I've done it once many years ago, but they talk about like your teeth. Some people have more sensitive teeth,
Yeah.
Mm-hmm.
and so the whitening could, be irritating to some.
Yes, yes. It,
Okay,
it is
so
a lot of the products now have really changed because I tried to whiten my teeth way back in the day, just initially, I like to try the products that I'm recommending to my
Mm-hmm.
patients. So
sure.
I use one and literally just to speak the cold air brushing across my teeth. It was so uncomfortable. I was like, oh no, we
Wow.
can't. I
Uh-huh.
mean, but definitely the products have evolved because a lot of people
Mm-hmm.
that was one of their major concerns. It's
Hmm.
my teeth are sensitive, but now they add things to their products, like particularly the one that I use that decreases that sensitivity that you may
Okay,
have. So that's why
okay.
I like the product I use. So
And then, speaking of sensitive teeth, I remember my father using Sensodyne,
yes,
Oh,
um,
yeah.
and I don't even remember.
Daddy was the first user, I think. And
Yeah.
it did did it come out pink? It's like the 1970s.
it,
It was
It was
something that
so
I never
horrible.
ever wanted to use. It
Like
was
it
so
felt
gross
like
to me.
punishment. Yeah. Yeah.
But I guess a toothpaste like that is for people that have sensitive teeth. But like, is it like I'm just brushing with a crest and that's irritating me, so I need to go to something like a Sensodyne?
in some cases, yes, that's what it is. That particular one of those toothpastes, your traditional toothpaste, is you need to switch over to a Sensodyne if you find that that's the situation, or you may
Okay.
find it in cases where you are thinking maybe you have some recession of your gums because
Mm,
over time you've kind of been a little more aggressive with that toothbrush, so you have part of your tooth that's very more sensitive to um, traditional toothpaste. So these Sensodynes have sometimes a little more fluoride in them. They have a little more what we call potassium, potassium phosphate, I'm sorry, and I'm not sure of the exact chemical in there, but
Mm-hmm.
it actually kind of plugs up some of the open tubules so that you have less
Mm-hmm.
sensitivity. And so,
Okay.
Crest has one, a sensitivity to Sensodyne does. They're just the Sensodyne is the hallmark for most of the sensitive
Mm-hmm.
Right,
teeth
right.
toothpaste. So, and they have a wide variety of them. And I try to just tell my patients, try to get the most basic toothpaste. You don't need whitening and anti this, and some of them have so much gimmick in them that of course you may find that you may have some sensitivity. But
Yeah, that
it's like
that
all these toothpastes are
yeah.
doing so much now.
Right. That's a really good point because you stand there and look at them and it's like the whitening, the this, the that, the other, and it's like the toothpaste with the breath freshener, and
Or
it's
how
like
about the one with the stripe? Remember, there's a dot, like
yes.
a red and a white. Yeah, yeah.
Yeah, and
And
it's
Yeah.
like I don't even know what I'm getting now.
Yeah, I in my office, there are a couple toothpaste that I do use, but just keep it pretty simple. Like honestly,
right.
like I have enjoyed using just the old school Crest. The Crest with the little
Mm-hmm.
red arrow on the side. Back in the
Mm-hmm.
that works well. Bottom line
Mm-hmm.
is toothpaste has polishing agents. Toothpaste has fluoride. Toothpaste has sometimes they have some breath fresh, they have mint or whatever, they have some
Mm-hmm.
flavoring in there. That's really all your toothpaste needs. That's why some people just use baking soda because it polishes. It's
Okay.
just it's a very extensive market, as you know, as you go
Mm-hmm.
Yeah.
into
Right.
that,
Right.
go into
Yeah.
to wherever you're going, and the toothpaste section is just ridiculous. But
Yes.
Yeah.
keep it simple. Just keep it simple.
Okay. Okay.
Keep it
I,
simple.
I, I get that like multi-pack from Costco.
Mm-hmm.
And that works too, buy it in
Yeah.
Yeah.
bulk if it works, just make sure, you're using it in a sufficient time that, the toothpaste isn't expiring too far out of the box. So just, yes,
Oh,
there is
Oh,
a,
toothpaste
yeah, toothpaste
expires.
has
toothpaste
an extra,
expires?
yes,
What?
there's an expiration date on everything. But yes,
Who
look on the
knew?
crimping at the very end of it. There's
Yes.
always a date
Yes.
on
Right.
there. So just look, just check. That's all.
Oh my
And
gosh.
so then is the efficacy of the toothpaste
Probably
less
not.
if it's
Probably, I mean, it may lose some of its efficacy, but you can probably still brush with it and not cause any damage. But
Mm-hmm.
just be aware. That's all I'm saying. Just
Who
okay, yeah,
knew?
don't
Who
use
knew?
some
like
toothpaste
mouth
that's
is
5 years old. Like, okay, yeah, it's time to get rid of that. But maybe 6 months
okay.
after the expiration date, you're probably still within range.
Okay,
I
I
I
learned something new
Yeah,
because
I
I
just threw out some salad dressing that expired in 2019. So I think I probably need to check my
Yes,
toothpaste.
yes,
yes.
definitely,
Wow.
definitely. That's
Now,
funny.
how much toothpaste do you need to put on the brush?
Not much.
Is it just a pea-size
That's what
amount?
they say, a pea-sized amount.
Mm-hmm.
That's all you need.
Okay.
It doesn't have to be the whole toothbrush. Doesn't have to be
Right.
covered
You
with
don't need to
toothpaste.
loop
Right.
it and curl it.
Yeah.
Yeah. Make a paste with toothpaste. Yeah.
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 Exactly. Less is more. That's what I try to tell my patients. It's not. It's the action of the brush is yes. The toothpaste, yes, it does wonderful things, makes our breath feel good and stuff, and it
Mm-hmm.
polishes, but you don't really need a lot. So that's exactly it.
Okay.
Okay.
I have another question. Now oral health is very important, but what type of diseases can you discover in some people's mouths just
Mm.
on a regular dental
Right,
checkup?
because you're
Like,
doing all of this stuff
what
and
what do you
mhm.
see that you would refer somebody to, like, oh, this is worrisome?
For me, anything that doesn't look really normal, and sometimes
Mm-hmm.
you will see lesions in someone's mouth or something in their mouth, and you're like, hmm, that doesn't look too good. Let's.
Mm-hmm.
Sometimes I'll observe it, but if it looks too like as a word that I sometimes use, angry, it just looks not
Mm-hmm.
good. Then I'm like, you should go see the oral surgeon. Let's go get a biopsy. Let's just make sure that it's nothing that we need to to worry about. I mean, obviously, the biggest thing to worry about is obviously oral cancer, and we
Mm-hmm.
just uh, it can be so unsuspecting. It can be,
Right.
just like melanoma, you can find
Right.
very small things that you think, that's nothing, and then it blows up and it ends up being something much, much,
Right.
much more severe. So I just,
Right.
as I'm checking, like you said, glands and things like that, I'm
Mm-hmm.
looking in your mouth, checking your tongue, definitely underneath your tongue. That's like a very
Uh-huh.
major place. It's, vasculature, anything that will look strange and just a little atypical, depending on
Right.
how atypical, will be like, go. Just go, let's see, make sure that it's nothing else. I actually diagnosed a patient who had leukemia because from her mouth, and it's just her gums just didn't look right, and I couldn't tell
Really?
you what it was, but I just knew
It
it
just
wasn't.
felt
It
off.
just felt off, and so a lot of times I'll have patients go see your physician, go have some blood workup, just make sure. Let's just touch all
Right.
bases because it's very important. It is so, so, so important. The link between your mouth and the rest of your body is you know they say cardiovascular disease. They say
Right.
it's the oral things that happen in your mouth can contribute to Alzheimer's. I mean, there's multiple links between your mouth
Mm-hmm.
and what's happening. Specifically, mostly periodontal disease. Periodontal disease
Mm-hmm.
is
Right.
really very, very significant and can cause some systemic things. And sometimes systemic things show themselves in their mouths, in your mouth as well. So
Mm-hmm.
Mm-hmm.
it's
Mm-hmm.
quite interesting. It's really fascinating. I had a class in dental school that was he's one of my teachers was an oral pathologist, and that was one of the things he said. The mouth can be the gateway to a whole bunch of other systemic issues.
Right.
So just
Wow.
that's why it's really important to see the dentist regularly and to have things checked out. Infections can be so serious that it can lead to death. If you have a
Mm-hmm.
swelling down here in your jaw, you could die from that, and that's serious. That is serious. She's like,
Judy, you're fine.
you're
You're
fine.
fine.
You don't have any
For
but
those
an
who are just
infected
listening,
tooth.
my sister is palpating her face to check for systemic disease.
No, but that's not. But just your teeth. It's an infected tooth. Can really cause serious damage to your
Yeah.
body, and so you just really, really, really have to be. I know that dental health is kind of the low thing on the totem pole. When you're sick and you're ill, you'll go see your doctor. I have patients who'll wait, like, how long has that been bothering you? Oh, about 3 or 4 months. I'm just like, why? Why don't you come see
Right.
some? And,
Right.
it's just obviously a bigger issue with dental insurance and dental,
Right.
you
Yeah.
Right.
start going into that realm and it's tough. It's just, it's expensive. It is. It can
But
be.
you also have that fear that so many people have of the
Right.
dentist.
Mm-hmm.
There's a lot of that prevents people from coming in. And it's strange because most of my life I had no issue going to the dentist, loved the dentist, actually wanted to be an orthodontist, the whole kit and caboodle. But in the last few years, I feel that my anxiety rises whenever I hear that whirring of the drill.
Oh my
And
gosh. Yeah.
it's bad. So if I need dental work, my dentist now knows, like, you need to give me something because the sound I cannot tolerate, and I will wear my headphones, listen to music, whatever I can do to drown that out.
Yeah.
But I think there's so much
Yeah.
fear around the dentist that people are less apt to go when there's an issue.
Yeah. And that's very true. I try to work through, you have to work through those old, people. I mean, unfortunately, people have had horrible, horrible dental care, especially as
Yeah.
kids,
Yes.
where you just, and
Yeah.
it's just so traumatic that coming to the
Right.
dentist, it can be just, and I just take my time, and like you, sometimes you have to pre-medicate, and
Mm-hmm.
and do what we have to do and do it in small doses, do it, with care and compassion, because you're right, fear will keep you away, and then that makes the situation even worse, because that's
Yeah.
Absolutely.
the issue. If you're not going to come, then then rather than a small issue, it becomes
Yes.
the big issue, and then it's even
Right.
more anxiety producing. It's just
Right.
Sure.
it's a vicious cycle that just
Yeah.
it's horrible. It is.
Wow.
I feel so much empathy and for patients who it is awful just to come to it's just like I can't even come. I've had patients leave because they're just like, I can't do this today, and I'm like, okay, that's fine. I respect that. I respect that.
Right.
So
Wow.
You know what? When I was getting my tooth extracted, they put headphones on me, asked what type of music I wanted. I said disco. And as
wow.
they were extracting, I was like, Last Dance. This is, Donna Summer tapping my feet. And honestly, it was a nice distraction for
Yeah.
me. And so if you know that you need extra distraction rather than just looking up at the ceiling, be prepared. Bring your headphones.
Right.
Maybe your dentist will have them so that you can not avoid taking care of your health.
Yeah.
Right.
And that's a good thing. I should, think about having headphones. I have
Mm-hmm.
music, but sometimes you
Mm-hmm.
need something a little more.
It was more
Right.
concentrated,
Yes.
and I could hum along, and
As
yeah.
best you could with your mouth open, right?
Yeah.
Right. Yeah, because I need the headphones to drown out the machinery.
All right.
Mm-hmm.
It's the noise that
Yeah.
that gets to me.
Yeah.
Yeah.
Good.
Yeah.
Yeah.
Okay, so I got one more question. How is it that you're able to understand us when you've got your hands in your mouth and you're asking questions? So
Yeah.
what did you do over the weekend? It's like, I don't get it. It's like a superpower.
um, I tease people. I tell people, "Oh, well, we took a class in dental school, of course." No,
Mm-hmm.
but no, it's just I don't know. Some people are very skilled at doing that, but you can fully
Mm-hmm.
understand them. And some people I just like, hang on, well, when we're finished, we'll come back to it, or
Right.
Right.
So I try to have people give, like, if something's bothering them, particularly while I'm working, hand signals, just wave your left hand,
Yeah.
not your right, because I'm on your right side and I've got the instrument. Wave your left and let me know. And I'm constantly trying to check on patients and making sure that while I'm working on them, you're still comfortable, everything's okay. And, true, I can't understand, like, oh yeah, last weekend I da 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 da, but I
Mm-hmm.
can understand some things. So
Yeah.
So funny.
Right.
It's that Bill Cosby
Wow.
thing,
Well,
huh?
Monica, this has really been a great discussion. And go check your toothpaste, see when the expiration is.
Everything else.
Yeah.
And hopefully, I'm hoping for our listeners, if you have fear of going to the dentist, that this discussion kind of made it easier to understand and kind of think of ways to overcome that. But it's very important that you don't take your dental health for granted. So
Yeah.
thank you. Now, Monica, if people in the Los Angeles area want to reach you, how would they find you?
You can find me. You can Google the Smiling Dentist, or you can
Mm-hmm.
Google my name. I do have a website, and do you post those, or it's Monica?
Yeah, we
Yeah,
can put
go-
them
go-
in the show notes.
Okay, yeah.
Yeah.
It's just my name, Monica Bruce DDS1.com. That's my
Mm-hmm.
website. So, you can look for me there. Dentist in LA.
Yeah.
Those are pretty much most of my links and stuff. I'm trying to think of, is there anything else? It's just so hard to be able to run my practice and you almost need a special
Keep up.
social media person.
Right.
I do
Yeah,
have an
right.
Instagram site, but I don't really post on it regularly. It's just,
Mm-hmm.
it's just too much. For
Right,
me,
right.
it is too much. I can barely do your chat with you.
Right,
I'm like,
right.
oh my God, this stuff isn't, I've got to do this. And so
Right.
maybe one day I can hire, a young person who can social. I'm trying to
Yeah.
get my son to do it for me, but he's like,
There you go.
Yeah.
Yeah.
And I will say, like, all my life, I went to male dentists. And then when I moved out here almost 8 years ago, I started going to a woman dentist. And the difference to me is like night and day. Because, like, I found when male dentists would give you a shot, they would do jiggling of the cheek and that dramatic stuff. My dentist will just take her time. She'll take a long time to inject, and there's none of it's a softness to her. Same like the oral surgeon. So maybe if you've been with male dentists, try a female. For me, I'm not going back. Not going back. So
we definitely have smaller hands, so that helps too. You know, when you're
oh
trying
yeah.
to, these men are like, open up your mouth. He's like, okay, I can't open it anymore. That's it. This is all I can do.
Right.
So,
Right.
yeah,
Would
yeah.
not have thought of that.
Yes. And,
So
and techniques with anesthesia. I mean, I'm sure some men, I have some really good, specialists who patients just love, and they're very gentle, and
yeah.
most of them are male. It's like unfortunately, my field, yes, there are a lot of female dentists, but a lot of them tend to be they like the peds, the kids, and things like that. So we're a large population. Believe it or not, there's more of us in dental schools now, but at the same time, it's just finding the right person where you're at ease and comfortable. That's what I tell people all the time.
Just like everything else. Just like everything else. Find the person that you connect with and stick with them.
Right.
Yep.
Exactly.
Well, Dr. Monica, thank you so much for joining us on Two Sisters of a Certain Age. It's been a real pleasure to have you and to talk and laugh about our oral hygiene.
Yes. Thank you.
Yes,
thank you.
you.
Thank you for having me.
So,
all right.
It's been a pleasure. So, Candy, how can our folks reach us?
Well, we're on YouTube, and if you listen to this and you want to see me take out my stay plate and expose a hole in my mouth, you can watch us on YouTube at Two Sisters of a Certain Age. We're on Instagram, Two Sisters of a Certain Age. And you can reach out to us at 2socapodcast@gmail.com.
Okay, thank you everybody for joining us, and we'll see you on the next episode of Tusoka.
Bye.
Bye.
No Longer Network.